Cannabis and its usage as a medical drug.
What is cannabis?
The psychoactive substance, also known as weed, comes from the cannabis plant, native to Central and South Asia, and it is mainly used as a drug.
It can be taken for enjoyment and/or health purposes. Also, it has been used in medicine for centuries, having a rise in popularity and usage as of late. Another popular form of cannabis is hash, which is derived from the resin of Cannabis sativa.
Smoking marijuana does have noticeable symptoms.
When consumed recreationally, it causes red eyes, dry mouth, impaired vision and hearing, and an increase in heartbeat, which gives a sensation of euphoria and a feeling of being high.
In the long term, smoking marijuana can weaken the immunological system, stifle motivation, and reduce the levels of testosterone and fertility. These effects often manifest years after the onset of the consumption.
Cannabis has many different components.
It actually has more than 400 different compounds, but the focus is on the two main ones, these being THC and CBD. THC stands for tetrahydrocannabinol. It's the psychoactive part of the cannabis. It changes brain activity, may cause hallucinations and delusions, and reduces the perception of time and space.
CBD, or cannabidiol, acts on the central nervous system. It represents more than 40% of the plant's structure, though it doesn't cause euphoria or intoxication when consumed on its own.
But how can this be used medically?
These substances can be prescribed to you by a doctor, usually after common medicine hasn't helped you become better.
Some cases where THC may help are in the treatment of patients with glaucoma, as it reduces eye pressure, for patients undergoing chemotherapy to help them deal with nausea, vomiting, and chronic pain, and also help people with HIV or AIDS by increasing their appetite.
When it comes to CBD, it is often useful in cases of inflammation, in psychiatric disorders such as PTSD, schizophrenia plus insomnia. It also can be used to reduce the chance of having epileptic episodes, as well as reducing multiple sclerosis spasticity symptoms.
How are cannabis, THC, or CBD consumed?
All three can be taken in many forms, such as through smoking, by baking it into food, by eating small candy edibles, swallowing pills, or inhaling vaporized spray.
CBD, on its own, can also be consumed through oils or lotions. This is not possible with THC.
There are, however, some side effects to medical marijuana.
Bigger risk of heart attack and stroke, cycling vomiting syndrome, hallucinations or mental illness, withdrawal symptoms, and depression.
It can also even lower your IQ.
Why you shouldn't self-medicate, especially as a teen.
Although cannabis can help people suffering from certain medical conditions, it shouldn't be a self-prescribed drug. When you're a teen, your brain isn't fully matured yet, and the use of marijuana impacts the shape, volume of, and how connections are formed within the brain.
It's also been proven that it can cause schizophrenia in young people and that it can have a worse effect than alcohol on cognitive development.
These situations are still being studied and discussed, so if you suspect that you are experiencing any symptoms mentioned beforehand or facing difficulties, speak to a doctor so they can help you find a more suitable solution for the problem in question and keep you safe.